To fit the recorder, ask the patient to remove their shirt or blouse so the arm on which the monitor is to be fitted is bare. Unless contraindicated, use the non-dominant side. In cases where there is a difference of more than 20 mm of mercury systolic between sides, use the arm with the highest pressure. For patients measuring their blood pressure at home, please use the same arm they use at home. Fit the appropriate size cuff. For the left arm, adult or large adult cuffs are supplied. A small adult cuff can be requested from the Oxford team if needed. For the right arm, only an adult cuff is purpose-made. For the other sizes, please use a left-sided cuff, taking care over positioning. The cable should go upwards towards the shoulder. The bottom of the cuff should sit at least 3 centimeters above the crease of the elbow. Tighten the cuff so you can fit your first and second finger between the cuff and the patient's arm. If the cuff is not positioned correctly, the recorder may not measure the blood pressure correctly and an error may occur. Connect the cuff to the recorder by screwing it in. Ensure the tubing is not obstructed. Take a test reading. Press and briefly hold the red Start-Stop button once. Ensure the patient is seated with legs uncrossed, relaxed and remains quiet and still while taking the measurement. The cuff will inflate to an initial pressure of about 185 mm of mercury. It may inflate further if the blood pressure has not been detected or during movement or arrhythmia. The average time taken is 20 to 30 seconds. The maximum measurement time is 90 seconds. Ideally, listen using a stethoscope or palpate over the brachial artery during the test reading. After the test measurement, the result will briefly display on the screen. This will only happen during the test measurement and not during subsequent readings. The time will reappear on the screen. If any adjustments are required with the cuff, this process can be repeated. Turn the recorder onto automatic mode by pressing and holding the black Auto On-Off button for about 3 seconds. Once switched on, the patient should not need to do anything else to the recorder. All readings are stored. The letter A will appear in the top left-hand corner of the display. Instruct the patient to have as normal a day as possible. Ideally, when they feel the cuff inflate, they should take a seat with the arm supported. If this is not possible, they should try to stay still with the arm across the midriff until they feel the cuff fully deflate. Instruct the patient to turn the monitor off by pressing and holding the black Auto On-Off button for approximately 3 seconds when driving. This may not apply to all patients. If there is excessive arm pain, and at the end of 24 hours when they can remove the monitor. Use the belt and carry case to keep the recorder around the patient's waist. This can be removed for sleeping and dressing as necessary. The cuff can be taped into position across the shoulder if there are no allergies reported. Advise the patient to remove the tape if redness or itching should occur. Note that the cuff may contain rubber. Ensure the patient has the instruction sheet, which advises against vigorous sport, using machinery or heavy physical work. Knows to complete the patient diary, especially sleep and awake times, and consider arrangements for the equipment being collected or returned. The monitor must not get wet, so bathing or showering should be avoided until the equipment is removed. Please complete the loaner form so the Oxford monitoring team can track which piece of equipment has been issued, and complete the patient details, including contact address and telephone number.